Good morning. I'm Steph. Steph Bolton. I'm one of the health and social care lecturers at the Hartlepool College of FE. Teach a range of different courses, so with school leavers and with adults, but I'm also involved with apprenticeship delivery at the College of FE. And today I'm going to be speaking to a couple of different students, one who is a current student and one who is an ex-apprenticeship with the college. And the first person I would like to introduce is Joe. So Joe, could you tell us a little bit about yourself, what apprenticeship you did with us, and when was that?
Hi, I'm Jo Lake. I did an apprenticeship in 2016. I completed in 2018, April 2018. I'm currently a third year student now, doing a nursing degree. I did the apprenticeship in clinical healthcare support,
Okay.
Which lasted about 2 years all in all.
So how did that apprenticeship come about for you then, Joe? Was it just advertised somewhere, or?
I went on NHS jobs. I was wanting to look into working in a hospital and caring for people and things. I was quite interested. And on NHS jobs, it was advertised NHS apprenticeship, and I applied and I got through the interview and everything. I didn't have many previous qualifications from leaving school, but I was told that that would be worked on 1 day college a week. The rest would be in practice.
Fantastic. So you went through an interview process then, yeah?
Yeah, it was
so was that quite a formal?
It was quite formal, and we had to do a little bit of English and maths, I believe, and I think we had to do a little bit of a writing exercise.
Right,
okay. To do it and things like that.
Yeah. That's good to know, because obviously the purpose of this discussion with you, Joe, is for future apprentices to know what's involved really, and for employers as well to see what sort of things we can offer apprenticeships in and sort of what the process would be. So that's really interesting that you said you saw it advertised and then you went through a selection process, if you like, and you were lucky enough to be given a place on the apprenticeship. So where were you based then? Who was your employer for this?
My first employer was Hartlepool, Hartlepool North. Well, it's North of Trees and Hartlepool Trust, but my first placement was actually in Hartlepool. I was on a ward. I think it was elderly ward, which was dealt with dementia patients and patients who were fallen and things like that.
So you said your first placement. So does that suggest that you went on to different areas within the hospital? Is that correct?
The first one ended up being about 9 months, I think, our first placement.
Okay.
We did like full-time placement, but we did 1 day college a week.
Excellent, right.
So we did all our academic work at college 1 day a week, and the rest of the time was spent in practice. So you'd spend, our first placement, I believe, was about 9 months, and then I think there was one straight after that, which was another 6 months. That was on orthopedics.
Oh, right. So a big difference then. So you get to see different areas.
Yeah, I did a placement on EAU as well, Emergency Assessment Unit.
Oh, wow.
It was really exciting and also very scary as well.
Yeah, can you imagine?
I've not been in a hospital before.
That's good to know.
Yeah.
So you mentioned there you came into college 1 day a week where you did your theory work. Yeah. So what did that involve? Was that sort of classroom sessions, taught sessions, and?
Yeah, it was mainly we got quite a lot of different subjects to do, and we did a lot of work with the teacher. The teacher would actually teach us things, and then we had like assignments we had to complete and things like that.
And did that link with what you were doing out in practice?
Yeah, that linked with our practical work. So we were actually learning on the job. So you were learning in the classroom what you were, and then you were doing that hands-on. You were learning
Great, yeah.
with patient, like communication skills, eating and drinking, like every aspect of personal care, things like that, you know.
Excellent.
It was a really good experience.
Good, I'm glad. So you found it very positive, the
Absolutely, yeah.
experience, yeah. What parts of it did you find most beneficial, do you think, then? Or inspiring, if you like?
I think I just liked caring for people, and the fact that someone goes into hospital and they're in pain and they're scared and they're on their own, and you were there to calm them, even if you just held the hand,
Yeah,
and like making a difference to their life because they were frightened or they were in pain, and just even talking to them, communicating with them, like they felt like
absolutely.
somebody was there for them, if you like.
Absolutely. And would you say that's sort of one of the most important things you need if you undertake an apprenticeship in health and social care, is to have that desire to
Yeah,
make that
absolutely.
difference?
Yeah.
Yeah,
People can tell if you care about them and showing them that you care, and I think it makes all the difference to people,
absolutely.
especially in that environment.
Good. So obviously, you are not a school leaver,
No.
and so how did you feel coming back into sort of the education setting and the process?
At first I was a bit apprehensive because obviously I'd left school quite a long time ago with not a lot of qualifications, so I was a bit in there thinking, am I able to do this at my age? But I got lots of support from my tutors
Great.
and lots of support in practice as well. And a
Excellent.
lot of people said sometimes you have more life experiences as an older
Mm.
student. So that really boosted my confidence, made me feel good, and like it helped me to think, you know what, I can do this.
How many others were on that course with you then from North Tees?
I think there was, I'm not sure, there was about 10 or 12, I
Right,
believe.
okay.
There was
And
quite
were
a few.
they,
Sorry, they were all different age
oh,
groups.
that's what I was going to ask. You read
Yeah,
my mind then. Yeah,
went from people who were 20 to 25.
great.
Um, and then I think I was the oldest. I was the,
Right.
the most mature one.
Yeah, excellent. So you mentioned there about how your role was one of the things that inspired you to do it was you wanted to make a difference to people. Has doing the apprenticeship transformed your life then, Joe?
Absolutely changed my life for the better. Yeah, I got into the apprenticeship, and that pinpointed me to say I want to do more. I want to be more because I know I can give more than. And I looked at the apprenticeship, and my tutor Steph, which was you, taught the access course on the night, and I managed to get onto that course, which I didn't think I would, and that took me down the process, which allowed me to apply for university, which is a massive thing, especially when you're a mature student, not like thinking you like your time's done sort of thing. You're not a youngster anymore, so you can't actually go ahead and go further your education. But I managed to get on the access course, which took me down all the lines of the process of that I needed to get into uni, and I applied and I got in, which was a massive shock.
Brilliant. And as you said, you're coming towards the end of that now, aren't you,
Yeah,
Joe? You're almost a qualified
yeah,
nurse, which
yeah,
is amazing progression. And you just a testament to show that it's never too late to go back into
absolutely not.
education. But also, I think you're never too late to take on an apprenticeship, because I think a lot of people do tend to have it in your head an apprenticeship is for a school leaver, it's for
That's right.
somebody
Yeah,
young. But yourself and a few of the others on especially on the health and social care courses, have had lots of different life experiences, so it's never too late. And the fact you're about to become a qualified nurse is just, fills me with so much joy to see how well you've done, Joe. Really does. What's
yeah.
your plans after you qualify? Have you got any particular route in mind?
Um, I'd love to be in a doctor's surgery and
Right.
do clinics and things like that. That kind of really interests me.
So you
Um,
want to follow me all the way, Joe?
I do. I'd like to. I maybe do a bit of the ward till I get through
Yeah,
my apprenticeship and things like that.
absolutely.
Get my
Yeah.
confidence and get my experience and everything. But I'd kind of like, because I'm a little bit older, I'd like to do like maybe a few days a week.
Yes. Yeah. Yeah.
So I'll have just like a few days of doing that, and I have other things I'd like to do. Obviously,
Excellent.
got kids and
Yes, exactly. You know, there's a lot of other things you've got to juggle in your life, but you're managing that so well. And I think you're a great role model for
oh,
anybody else who's wanting to do this. Yeah.
first I was really scared, but it's the best thing I've ever done.
Oh,
I'm a total
excellent.
different person, and it all stemmed from the apprenticeship.
Oh, well, that's great to know, and I think that's a great point to leave that on, Joe. Thank you so much for that valuable time today, because obviously you are working on the front line. You are a
Yeah.
very important, valued key worker. So to give us this bit of time to tell us about your journey is fantastic. Thank you so much for that, Joe.
Oh, thanks to you as well, Steph. You helped me all the way.